Hey everybody, and welcome to this week's call, Q&A with our menopause expert, Kathleen. Nice to see you again, Kathleen.
Nice to see you too.
It's early morning there in the US, and it's midday here in the UK. It's actually very, very hot, unbearably hot for summer here in the UK. But we plod on. So we have a few questions. Thank you very much for sending them in. So we won't waste any time, so we'll get straight into it. And the first question is, does menopause belly fat ever go away? And what can we do to get it to go away?
Yeah, that's a great question. So let's kind of talk about where the belly fat comes from too. And that's because as estrogen, with estrogen in your body, which you have higher levels prior to menopause, it goes more toward your hips. And when there's that reduction of estrogen throughout the menopause transition, then it shifts fat deposits, which go around your belly. So that can expand your waistline, unfortunately. But what are things we can do? It's not going to go away overnight. It is going to take some nutritional modifications, reducing calories, increasing the protein intake, and really, there's not enough that can be really said for integrating some of that strength training in. A lot of people downplay it, but we can't outrun a bad diet in some respects. So being able to pair the diet with some of that strength training and cardio is going to be really, really important. The other thing we think about too is stress hormones like cortisol. And when we are highly stressed in life, we tend to have higher cortisol, which can have some more fat deposition around the belly. So making sure we're doing low stress reducing activity is another one. There are certain conditions that tend to have fat deposits around the belly. So it is a good thing to talk to your healthcare provider to make sure you don't have some of those disease states like diabetes, and staying up on your routine healthcare as well.
Yeah, a great answer. And I've read some research that kind of suggests that pre-menopause women will store around 5 to 8% of their body fat in the abdomen, whereas like during the menopause and then post-menopause, that increases to around 15 to 20%. So that body fat deposition, the shift in body fat deposition, is a real thing. And I think if you strip it back to basics, as you mentioned, just think of body fat as stored energy.
Mhm.
So ultimately, we just have to think of ways in which we can utilize that energy by modifying your diet and modifying your exercise. And over time, you can utilize those energy deposits, and it will go away, but it just takes time, and it takes consistency, of course. Obviously the hormonal changes are working against you, so you ultimately have to work a little bit harder in many cases. But no, that's great. And the second question, what is the quickest way to get those hormones rebalanced for steady weight loss?
Yeah. So there are ways to increase kind of a balance in hormones, or kind of feeling better, and that is keeping kind of those healthy, consistent lifestyle behaviors, which consistency we know can be hard. Unfortunately, there is not a magic wand that anyone can wave to steady these hormones right away, but doing consistent movement, focusing on sleep, stress relief, and your nutritional intake are all good ways to do this. Um, there are if you there are about 3 to 4 different categories of women that most studies look at, and that separates kind of the hormone imbalance mainly surrounding vasomotor symptoms, which are hot flashes and night sweats and things like that, which people consider some of the most bothersome symptoms around hormone changes. And we see that some of those people, there's a mild to moderate category that have really low hormone, or not low symptoms that accompany hormone changes. And then we have a more moderate to severe, or moderate to longer term folks. And then we have a more prolonged category. And what that can mean is sometimes these hormone changes can affect us from, barely affect us for like 0 to 1 to 2 years, to the moderate category going to 4 years, to sometimes 7+ years in that longer category. What can help us is staying consistent in our lifestyle routines, And then again, if there are bothersome symptoms too much, consult your healthcare provider. But if you keep that consistency in sleep, reduction of stress, movement, all of those things, those are going to help you return to your homeostasis, where your body kind of settles down on those fluctuation of hormones better.
Yeah, I like that answer. And I think it's also like, because hormonal balance is on trend, is like a trending term, isn't it? And I think it's important that people realize that hormones fluctuate naturally during the day anyway. So the reality is,
Exactly.
if you flatline all of your hormones, then there's going to be a disaster, really.
Yeah.
But yeah, those lifestyle like levers of like diet, exercise, sleep, stress, those 4 lifestyle levers, they're the most significant, or they have the most significant impact upon your endocrine system, hormones, all these kind of things. So rather than seeking the latest and greatest supplement, first and foremost, like, focus on those levers and make sure that you're in control of all of those things. And then you'll be 99% of the way there. Nice.
Exactly.
Question number 3. So it's pretty similar to question number 1, but we can go probably a little bit different, maybe. Weight gain through the menopause and weight training. I feel like I'm gaining weight from both. So this lady's a little bit concerned that she's obviously gaining weight as a result of the hormonal changes during the menopause, but then weight training is also kind of increasing her weight as well. How can I turn my mindset to positive thinking, knowing weight training is important and good for me?
That's a great question. Well, let's start off that, good job trying to engage in the weight training and doing all those positive lifestyle activities, and be patient with yourself. Be nice to yourself and be honest with yourself as well. So if you know that you're making the right steps, and you first would be also to understand the disease process. So we know that our fat deposits, as we talked about before, are shifting. So what may feel like a weight gain might be the way our body is processing these new fat storage. So let's think about some of those things. Then the next thing is, let's review those 4 levers, as you mentioned, on what you're going through. And take a look a little deeper at the caloric intake, the movement you're doing, the amount of strength training you're doing, the sleep, and going back to those basics and keeping those on a steady, consistent. It's not going to be an overnight change. When we want sustained weight loss over time, the slower incremental is better, because we are more likely to keep that off. So kind of level setting expectations mixed with making sure you have these lifestyles and understanding the process of menopause and the transition through this normal physiologic condition, will also kind of help level set as you go through your weight training and all of the menopause hormone training, and getting to know your body through these changes.
Yeah, nice. I also think it's important to realize that, as we discussed earlier, that those hormonal changes are essentially reducing your metabolic rate. So your metabolic rate might decline by around 300 to 400 calories perhaps during this menopausal period. So you really need to think of ways in which you can fight against that. So diet, so increasing your protein is going to increase the thermic effect of feeding and speed up your metabolism, if you like. Weight training will do exactly the same. Sleeping well will do the same. So all of these things, they're like plugins to fight against that metabolic change that's happening during the menopause, that will hopefully offset those big physiological changes. So that's a real positive of the strength training, of course.
Yeah, and kind of just to add on that to a little bit, cardio is great because it gets your heart rate up and everything, and you burn the calories right when you're there, but that sustained caloric loss does not necessarily stay. Where with weight training, when you're building that muscle, it keeps that caloric need up, so you're burning more calories at rest, which you kind of referenced, and the thermogenesis. So that's really, really vital.
Yeah, and not only is weight training great for your muscles, but also your bones as well, and there's psychological benefits to it as well. So I mean, all in all, it's probably one of the best, most important forms of exercise you can do, really. Cool. Question number 4, how to get back the libido? So how does someone like return or get their libido back?
Yeah, there are many different ways, and to not sound like a broken record, staying in some of those lifestyle lanes and keeping your house in order with your and when I say house in order, I mean with your nutritional intake, your movement, exercise, all of those things. Those are really important. Stress plays a big role in libido, so doing those stress relieving activities are important. Now, there's different reasons for causes in decrease in libido. So that's something else that you might want to explore, because sometimes it's truly integral to the decrease of hormones and lack of interest. And if there was a heightened interest or increased interest and then it's lower, that's kind of one thing. Then you talk about decrease of estrogen to the actual vaginal site that can cause pain and things like that, where you can do lubes and different things, or vaginal creams that you talk to your doctor about. So and then also stress, where you can go through therapy and talk and kind of the changes of your body and get back into a mental space. So starting with those basic lifestyle measures is always what we're going to drive back to, because that's going to get us to the best level set state. But there are other causes that you should be aware about in the event that it applies to you and you want to go and talk to a healthcare provider about. But also at the basic level is scheduling time for intimacy, and whether it's with yourself, a partner, and having that libido intact and giving it an opportunity, because we can fall out of a pattern as well. So if you have your lifestyle balance, scheduling time for intimacy, and then going from there is a great basis to start off at.
Cool. And then finally, we've had some questions about hormonal replacement therapy. So here are our three things that we recommend in regards to hormonal replacement therapy. One is that hormonal replacement therapy essentially regulates the hormonal fluctuations that occur naturally during the menopause, and it can improve the quality of life for sure. Number two, concerns about breast cancer risk with hormonal replacement therapy have been refuted. There's actually a very small risk, similar perhaps to the contraceptive pill. And then three, hormonal replacement therapy also eases symptoms, menopausal symptoms, so hot sweats, hot flashes, those kind of things. But it also benefits bone health and also cardiovascular health. So it's not just about those offsetting those menopausal symptoms. There's huge health benefits to it as well. So if you are finding yourself like really struggling with menopausal symptoms and you've tried diet and exercise, you've been consistent with the Reverse Health program, then it might be time to speak with your medical practitioner about hormonal replacement therapy, and they can advise you a little bit better. Did you have anything else to add there?
I think that's pretty much sums up the three direct points. You did a wonderful job.
Great. Well, that's all the questions. So thanks again for sharing the questions. And it's always great to interact with you. And Kathleen, thanks for taking the time here to answer the questions.
Thank you. Have a good day.
Thanks. Speak soon. Bye.